Hi, this is Dr. Sheetal Agarwal. I'm Senior Consultant Director Ops and Gynae at Cloud9 Hospital, Kailash Colony. So continuing with the pregnancy series, today I'm going to talk about what are the causes of bleeding immediately after you become pregnant in your first trimester. The most common cause is the implantation bleeding. When the embryo which gets implanted into the uterine wall, it can cause slight spotting on the bleeding which can come at your usual period time, so you may not even come to know that you are pregnant. So a lady thinks that she has her periods whereas she is pregnant at that time, and that was implantation bleeding, which is very common. Don't get worried or don't get confused about it. Second most common cause of bleeding in the first trimester is when you have threatened abortion or an incomplete abortion. By threatened abortion, I mean that the fetus is trying to grow inside the womb, but it is not able to grow. It could be due to various reasons. It could be subterraneous, it could be any intrauterine polyp, or it could be submucosal fibroid, anything which is hampering the blood supply of the fetus, threatening its growth. So that can cause bleeding. Or sometimes it just, the fetus just aborts completely and you start bleeding, then it is an incomplete abortion. Only a part of it is inside and most of it has come out. Other causes of bleeding in the first trimester are many of a cervical polyp. Sometimes after sex you can have bleeding whereas the fetus is alright. Other causes could be when you have multiple pregnancies, especially in IVF cases. You have 2 or 3 multiple pregnancies inside the uterus and you can have bleeding. Infection is another very important cause of bleeding in the first trimester which should be looked into carefully. Thank you.